everyone. Thank you for tuning in tonight in this very COVID-safe environment for 2020.
My name is Dr Victoria Phan and I'm a GP and I'm also a risk advisor at Avant. Welcome to our medical students, our future doctors. For tonight's interview, we have a very special guest, Dr Sonia Henry, a fellow GP and the acclaimed author of Going Under. For those who haven't read Going Under, it is a rare insight into the world of an intern and takes an unflinching look at the reality of being a doctor. Sonia, you're currently practising in the remote Pilbara region of Western Australia, but arguably you rose to prominence through your literary prowess. So congratulations on the success of your book and thank you for joining us here today.
Thanks, Vicky.
I thought perhaps tonight we could talk about what you encapsulated so well in your book, the ups and downs of being an intern, not the things that we learn in medical school, Circle of Willis, Krebs cycle, how to make a good consult, how to get into a training program. But let's be honest, I bet these guys probably know better than we do. But I wanted to chat to you about what it's actually like sort of hitting the ground running, in those first few years and what the daily grind is like. For me personally, I was an intern not so long ago myself, and I found my internship a real emotional roller coaster with some triumphant moments mixed with some really crushing defeats, often on the same day. So can we talk about a few firsts for you, Sonia? Tell us about your first day of being an intern.
Well, it's going back a little while now. Yeah, I remember my first day as an intern was very scary because it's the first time that suddenly you're actually a doctor. And I think we've discussed this before. There's this idea of when you're an intern, people say, oh, you're just a PA or a bit of a paper pusher or you work the fax machine. But in reality, you are a doctor and you are doing doctorly things. And I think what I really remember is having to chart some morphine and the hospital I had a computer system and so it wasn't a physical handwritten med chart, so when you typed morphine in, which is a relatively easy thing to do, then a warning would come up that the patient was on another opioid and it was a surgical term, so yes, of course the patient is going to be on a lot of strong pain relief. But I remember my stress levels were just so high because you're just looking at this very simple task to chart 5 milligrams of morphine, PRN, and these warnings are flashing up and I'm standing there sweating thinking, oh, what am I doing? And the nurse was sort of like, what are you doing? And I was kind of thinking this shouldn't be really that hard. And then you realise something that simple that in medical school or a print term or whatever would feel quite easy, you realise it's your name on the as the prescriber, it's your registration, it's you doing that. And then I think the power of it really hit me, yeah.
Yeah, absolutely. That takes me back to my own experience. The first time I ever charted something, mine wasn't probably as strong as yours, mine was Maxilon. And I remember I turned to my registrar at the time and I said, is it 10 milligrams TDS? And look, she was a very intelligent and stern registrar and she turned to me and said, yes. And at that moment, I felt the power. You were like, wow, I'm a doctor. Today I'm a doctor. And I think that's the moment that you really realise that you're a real doctor now because you can prescribe.
Yeah, and it's very frightening. And then you realise if you make a mistake and it's sort of on you or you have to tell someone you've made a mistake and that's very frightening as well. And those things really hit me during my first few weeks, particularly of internship.
Yeah. Tell us about the first time you put in a cannula.
Oh, yeah. Look, yes, I was one of those medical students who sort of tried to avoid cannulas. I certainly wasn't rushing around on my weekend trying to learn how to do it, which, was probably in hindsight something I should have done. But I just kept thinking that I'd learn on the job. And then on the job, it was, a total catastrophe. So to the point where I was sort of going home at night thinking I need to enrol myself in some kind of cannulation course that maybe I could do secretly that no one would know about because I was like, nurses do these courses, maybe there's one for me. But then it was actually my medical student, because I was the intern, who was really good at cannulas because he was one of those students who and this did actually inform loosely a part of my book, who was very good at them. And the patient was sort of like, I'd screwed up the cannula and Steve, my medical student, shout out to Steve, showed me how to put in the cannula. And because he was my student and I was the intern, there wasn't this funny power struggle. He was just helping me out. And he was also a really decent bloke. And then I became really good at cannulas, I think, because someone had just taught me how to do it without me feeling like I was going to die when I put in a cannula, or the patient. And yeah, that's what I remember. Yeah.
Yeah, and look, I mean, I think that's really powerful, and I mean, especially that your medical student actually taught you how to do something.
Yes, he did.
And I think that just shows us that, you know, it doesn't matter if you're an intern, a medical student, a registrar. I think we can all learn from each other. And I think, you know, in this sort of situation, you clearly learnt how to ask for help.
Yeah, and Steve was very kind, you know, and I think that is also the basic premise of my book was this idea of we need to be kind to each other, and that's probably something you need to start learning, well, as a human, but as a medical student as well. You know, medicine's very competitive, it's very cutthroat, the job situation is difficult. But if you attempt to be kind and help out your colleagues, you know, help will come back to you.
Yeah, absolutely. And I think that the further along that we get, we realise that medicine actually is quite a small world.
Very small, very small. Yeah.
And it has a very short memory. So I think kindness to your colleagues, and that is not just your doctor colleagues, it's the nurses, the allied health staff, the cleaner, you know, the ward clerks. I think it goes a really long way, you know, and I often tell juniors as well, you know, one day the nurse that you're working with today could be on the panel for the interview that you're going for as a consultant. You know, it goes in circles, and so I think being
definitely. And on the flip side of that, you know, if you're being mistreated at work, I think we are at risk a little bit of always saying we have to be. It's up to us to be kind, and then you sort of get into the situation as a junior doctor where you're being super kind to everyone, and then other people aren't being as kind to you. So then I think there's this idea of we need to also recognise when people are treating us badly, which is, you know, well, I suppose we can talk about this a bit later, strategies on how to manage that and that sort of thing. But that's also important. Like, I think I was so afraid of being perceived as not a hard worker or not a decent person as a junior doctor that I then allowed myself to be treated badly in situations that I should have, looking back retrospectively with the retrospectoscope, it would have been a good idea at the time to flag that. Yeah.
Look, tell us about a time, or the first time that you cried in internship.
Yeah, I was on the ward. I cried quite a few times in internship and residency. I'd had a bit of a run-in with my registrar. It was a very busy term, and, you know, it was stressful. I'd ordered an incorrect test, or a test that I thought I should order in that context, which probably wasn't super wrong, but it wasn't super right either. I felt very humiliated when I was told that, you know, why had I ordered this? And it was almost like saying, like, why have you just torn apart the Eiffel Tower? Like, as in, it was pretty unnecessary. I mean, I get that they were stressed too, but then the stress came down to me, and they were in theatre and I was the only person on the ward. It had been a very long week. I'd done a lot of after hours, and I felt like such an idiot, you know, and I remember sitting at the nurses' station and I just started crying on the ward, just crying. Actually, looking back, I probably look like a total fool, but that happens a lot in hospitals. That was the first time. And then there were other times, and, you know, and I'd see people crying or hiding in corridors crying, or that stuff happens, yeah. And we sort of pretend it doesn't, but it does. Yeah,
and I think, look, that really speaks, you know, to the reality of how stressful the job is.
Yeah.
That, you know, to feel that you're pushed into a corner, that the only way that you can release is, you know, have a cry. I mean, no doubt we all cried and probably felt better afterwards, you know?
Yeah. I mean, I was pretty embarrassed, but I think I had no other choice, you know. It was... And I cry now at work for different reasons, usually if a patient is very upset, or, I mean, I'm quite an empathetic, emotional person, I suppose, but I would hope that the junior doctors of the future did not cry as much as I did, or perhaps my predecessors. But unfortunately, There will be times when that will happen, yeah. I hope it's for a reason that you're stressed out because of a patient situation or something beyond your control, and that it is not because of a senior. But that, unfortunately, in high stress situations, people behave in unfortunate ways.
And look, I mean, you allude a lot to, you know, people's behaviours in high sort of stress environments.
Yep.
And look, I mean, you talk about it in your book as well, although it's completely fictional. But, you know, can you tell us an example, I think, of a time where, you know, you really felt really under the pump and, you know, and how did you deal with that?
Oh, there was actually, I do like this story, and in a way I wish I'd somehow put it into my book. I used to have a saying with my housemate that nothing stops the clock, because when you're on a very long shift and you've worked many nights in a row, really you just want it to end. It's not like you're running around thinking, I'm really enjoying this. It was more just like, I really want this to be over before something bad happens. And it was the daylight savings changeover. So my whole premise was nothing stops the clock, you're going to get through this. And it was a really bad night, and, you know, it was a ward that I didn't have a lot of experience on, and it was the pager was being relentless. And then I remember looking at my clock and it was 2:59 on my phone, and I knew the shift finished at 8 a.m. And then I looked at my clock and it was 2:59 again because the changeover happened, and I, you know, gained this, well, you know, gained the hour, whatever, the shift became an extra hour. And I remember thinking, oh my goodness, like nothing stops the clock except tonight the clock has actually stopped. And in this hour, there were 2 code blues or met calls. And I remember we were standing over the bed of a patient who was, you know, totally unconscious and was going to be taken to ICU to be tubed, and they were doing everything. And I said to the ICU reg, because we were all so tired, I said, do you think we're going to get paid for this hour? And he said, no.
It was still 2:59.
Yeah, exactly. It was sort of this amazing... And I remember walking into the doctor's room and just looking out the window, and I could see my house from the doctor's room, and I was so exhausted. Yeah, I look back, I don't really know how I just sort of kept... Well, you would understand. We just keep on going, right? You just keep going.
And I mean, look, in your book, you definitely allude a lot to not being able to cope. I think just the whole idea of coping, and certainly, you know, when you're on your 7th night shift, you really do wonder whether you can cope. I mean, look, let's talk about night shift. I mean, that's a reality of being a junior doctor, overtime shifts, night shifts.
Yeah.
Can you talk to me about your worst night shift?
Yeah, I mean, I had a lot of pretty bad night shifts, but I don't know if there's one in particular that sticks out as being my particular sort of worst ever night shift. I think runs of night shift were very, very stressful, and you were extremely tired. I sort of have vague memories of things like, I remember once looking at an ECG of a patient who had chest pain, and it would probably close to the end of the string of nights, thinking, I don't really know what this ECG says. And, you know, the ECG thing has a little thing at the top, and you're kind of looking at it thinking, is it really this bad? But I don't really know. And I sort of remember thinking, I really should call the senior on the ward, who was also very busy and pretty angry. And then I remember saying to myself, well, if I don't call the senior on ward about this and I kind of ignore it and the patient dies or something really bad happens, I'm going to be blamed for it. And really it was because I just didn't have the guts to make a phone call. So I had to sit there for like 15 minutes arguing with myself about whether or not, I mean, and this sounds very simple, right? I think only junior doctors or doctors generally will understand the fear of getting on the phone to someone when you're scared that you're going to be yelled at or you look like an idiot, you know. But of course, as an intern, there's so many things you don't know. I mean, even now, we've been GPs for a while. There's lots of things we don't know. You call for help, But yeah, I still remember the ward I was sitting on. Like I remember thinking, I really need to make this phone call. And I did, and I can't really remember what happened. The patient was sick and something occurred, but it was this very strong memory of the fear of knowing you were the only person on the ward or 2 wards. The senior was somewhere. There's not many doctors in the hospital. and the responsibility was on you, and that was very stressful, And that's sort of what I remember about night shifts.
And I think times like those, that's when you do feel like a doctor.
Very
as
much
well.
so,
You're not just a paper pusher, you're not just doing discharge summaries, you're a real doctor, and being able to interpret that ECG and come up with a plan, that's on you.
Yes, and even if you don't really feel like a doctor, you know that you are one, and the responsibility is that of a doctor, and that's you, regardless of whether you have imposter syndrome or feel like a bit of a fraud or whichever, of course I did. But I remember thinking, I'm going to see this patient and say I am the doctor or to the patient, they don't care. Like, it's you saying a doctor, therefore you're the person caring for them. And I think, we should stop probably saying generally that as an intern you're just a PA and all the rest of it, which is sort of a thing that people say. You are a lot of the time, but then when you're not, those times are very important.
Yeah.
And
I think it is really important that during the day, when you do have all the support from your registrars, from your colleagues, that you do learn and pick up those skills.
Yes.
Because they're what you use on your night shift.
That is very true. And I think as well, if you have registrars or consultants who you've developed a bond with or who you trust to ask things, then much, much better to ask. There's nothing worse than I think anyone in medicine, be that allied health, nursing, doctoring, who thinks they know a lot but actually know very little, as opposed to thinking you know very, very little but actually knowing more than that. You're better off thinking you're on the back foot and asking for help even when you don't need it, because that's how you learn.
Did you find it hard to ask for help?
Yes and no. It really depended who the team was. I think there are some registrars and consultants that were very difficult to ask for help because they were not very nice people. And then there were consultants and registrars who were just really, really exceptional, and they were the people who you really could ask for help, and I did, and I sort of write about that in my author's note in my book, that it makes an enormous difference when you have someone in a senior position who has your back, and therefore I think if you find someone like that, and you'll get a sense, of course, you need to make the most of those relationships in that way, as in you need to ask them for help or flag, that there's a problem. Because nowadays I think we are more inclined to have these conversations, and no one wants to be told that they're bullying their intern and I think that has been a change in the last few years, something that I am personally kind of proud that I wrote some articles and wrote my book about, because at least it's in the public domain, and we can now say, hey, I don't want to be going home crying because my list is 40 patients and it's just me and there's another intern on a team with no patients who could be helping me. And I think these days we can have more of those conversations.
Yeah. Talking about night shifts, I mean, obviously as junior doctors, we go from day shift to night shift to overtime, and it just stuffs up your sleep cycle. Can you tell us a bit about, coping with those, shift changes and how you took care of yourself?
Yeah, well, I mean, the character in my book had some unhealthy coping strategies, which I don't recommend. But I think giving yourself enough sleep during the day, and I mean, I was never one of those people who would get home and go for a run and do a bit of study and do some yoga and then go to bed. And I think if that's what you're telling yourself you have to do, you don't have to. Like, medicine's already hard enough. Like, get enough sleep, try and eat relatively healthily, and talk to your friends about how you're feeling. I think on night shift you're very, very vulnerable, and you're very lonely because you don't really see people. And you go to work and you see your colleagues, but it's not really like having a chat because you're on separate wards and you're very stressed. And I think that having friends that you can talk to on your days off is very helpful. But yeah, your body is going to be relatively screwed over by working runs of nights. But sleep and, hydration, exercise if you can, and if not, just sleep and talk to people.
Yeah. I think, talking to people is probably one of the most important things that got me through, night shifts and just internship, and I think certainly one of the big themes of your book are very much, your friends that sort of get you through.
Yeah.
Can you talk about the friendships that you've made, in internship or before internship and where you're at now?
Yeah, I mean, that's a good question. And I think that some of the reviews of my book I found very heartwarming when they said what I really enjoyed was this sense of camaraderie between Kitty and her mates. Kitty's my main character, which again was reflective of my own experience. And there have been times in my life through medical school, internship, residency, training, everything where you look back and you say, have I made a mistake? You know, do I regret choosing this career path? Would I have done something else? And I think we're not humans unless we question our choices. But I will say the one thing that's always stopped me from really saying, even in my most dire of moments, you know, I regret this, is that I made the best friends that I've ever made during medical training and then my internship and residency. And without those friendships, you know, I wouldn't have gotten through it. I don't think I certainly wouldn't be able to have the conversations that I can have today about it. I very much doubt that I would have been able to write the kind of very candid book that I did, despite being, you know, a fictional narrative. It's still inspired by real experiences without my friends. And yeah, they really, it's what I think we've talked about before, is this idea of if you find good friends who you can trust, you really need to stick with them and be honest with them about how you're feeling.
Yeah, and I would really agree with that. And I think, you know, having interned at different hospitals as well, I think the friends that you intern with and you go through your junior years with, they're the ones that are your friends for life. And, you know, they kind of go through the same experiences. And I always say you come out on the other side and you've just got the same badge of honour, you know, going through that internship. And it's one of the hardest experiences, I think, in our career and life.
Yes, it is. And it's good to hear someone say that, because I think everyone will be exposed to the sort of dinosaur-esque figures in medicine who are like, well, back in my day it was much harder. And one, I don't actually think that's necessarily true. I think our group of, or my generation, our generation of interns, residents, registrars are facing very stressful things like the bottleneck of registrar positions and the unaccredited scenarios. And, you know, I've talked about this ad nauseum at interviews and stuff, but being an intern is hard. Being a resident is hard. The first few weeks of internship are particularly hard. Changing terms every 10 weeks is difficult. Whatever anyone says or whatever mask they're putting on, it's hard. And the best way I found to get through it was by having very good friends. And they're out there. Like, you know, I felt like a bit of a fish out of water in medicine, but the fact that I found these amazing people who I'm still extremely close friends with today is a testament, I think, that, yeah, you can find each other. Like, your friends, I imagine, are still friends you've had from that time of your life.
Absolutely, and I think it's hard because, like you said, medicine is a very competitive place, and you know, questions from the audience have come through, you know, alluding to, you know, how do you stand out as an intern? How do you be different? How do you compete? How do you get onto training programs? And you know, I'm going to pose that question to you. You know, with this advice that is like, look out for each other and have friends. You know, it almost seems like they're a bit of a mismatch, but is it really?
Really good question, and you framed that beautifully. I think, yes, there would be people watching this, or perhaps not, who would think it doesn't really matter because my main goal is to get onto this XYZ training program, therefore I can kind of just leave everyone else. And my real main advice is, how do I write 10 papers around the primary author and get to conferences and, you know, suck up to the right consultant and get a good reference? Those things will help you get points on your CV, I suppose, but will they help you when you've had someone die on your shift and you think maybe it was because you've overdosed them with potassium accidentally or something like that, and you go home, suddenly that future doesn't feel like a future anymore because all you can think about is, what have I just done? And this person is nearly dead or dying or dead, and I feel responsible for it. I feel blamed. Hospitals have a culture of blame often associated with them. So then your points on your CV and your primary authorship and all the rest of it, that's not very helpful. But having friends will help, because if you can't get through, then you're never going to be able to achieve those other things. And advice like how do you write a paper and how do you meet the right consultant and how do you, you know, get to a conference, they're relatively easy to answer. I mean, I've written papers and I'm a GP. So you just speak to your consultants. You have a nice consultant and you say, I'm interested in research. And consultants love people interested in research because they want you to write the papers. And so then they can tack their name on the end as, you know, and you're the primary author and they're very happy for you to do it. And how do you get points for your CV? Well, yes, you enrol in the courses that the hospital recommends, and those things are right in front of you. They were not difficult. It's what I think is difficult is acknowledging to yourself that you've got a really hard job and you need really supportive environments in order to not go crazy.
Yeah. And look, I mean, in that you definitely mentioned, you know, unfortunate death of a patient. Can you talk to me, I guess, about the first death that you experienced and witnessed?
Yeah, I think we spoke about this earlier as well. I mean, I just actually had a patient of mine very recently die, which was very stressful even now. But in the hospital, I'm just going through now all the deaths that I've certified. There were so many. Probably the one experience, and this isn't the one we've discussed previously, this is actually a death certification, but it's just come into my head. It was when I was in the emergency department and the admin lady, it was at 3 o'clock in the morning, came up to me and she said, there's a DOA. And I was like, what? And she said, oh, there's a DOA. And I was sort of thinking, what's a DOA?
What is a DOA?
And she said, well, you know, it's a dead on arrival. And I was like, oh, right. And so, you know, and this is also actually one of the chapters in my book, sort of loosely based on. And I didn't realise then that we actually had to certify deaths. And no, because no one had told me. And then, so you go out in the middle of it was, you know, the summer and there was this, you know, corpse in a body bag and you're sort of standing there going, oh, okay, I'm trying to remember my medical school, listen to the heart, you know. And it was so absurd because I actually remember having a discussion with admin about this later at like a drinks thing where I sort of said, I was a bit stressed out the first time I certified a death. And they're like, do you have to do that? And I sort of thought, well, what do you think happens, you know, when we're in the big bad world of the ward or the emergency department? Like it shocked me that an administrator at the hospital I was working at didn't know that an intern had to do that. Yeah, and that, like I said, that was just a memory. That wasn't the first horrendous death story. It was just the first time I'd certified a death and it was really intense. You know, it was really intense and no one had really talked me through it. Actually, I only found out very recently you can call your insurer who will help you talk you through that, which I had no idea about.
Yeah, look, I remember the first time I had to do a death certificate. It was 2 a.m. in the morning and I was sitting on this ward and I was going through all the coroner checklist questions that you're supposed to go through. And I said, I don't actually know how to fill this out.
Yeah, it's confusing.
And no one teaches you. And I guess it's something that you just learn on the job. And I remember ringing my registrar and saying, do I have to tell the consultant that the patient's passed away? And they said, not now, it's only 2 a.m. in the morning. And again, in retrospect, it was definitely something I didn't realise that at that time I probably could have called Avant and got a bit of help.
I had no idea that I could have done that. And I would have. I would have called, well, I actually was with Avant. I'm still with Avant. I would have called them because I didn't know. And when you've got someone very casually saying there's a DOA, as if, oh, there's a cup of tea outside, you think, oh, yeah. But then you're like, oh, right, okay. And that, I remember that very clearly because I just had no idea what to do. And then obviously, you know, more of that happens and all the rest of it. But yeah, it was, again, one of those situations that is totally absurd. And I would go home and tell my housemate about it, who actually wasn't a doctor at the time, the girl I was living with, and she was like, mate, these stories are crazy. And you're sort of thinking, well, no, it's just what I have to do. But it actually is pretty crazy.
Yeah. And I think sometimes when you're sort of really stuck into it, you forget just how real some of these experiences are. You know, you come at the end of a weekend on palliative care and you've had 3 patients die over the weekend. You forget that this is life. Like, this is life and death that we're actually talking about, and we're asked, look, can you sign these papers? I think it is quite surreal at times. Can you run me through, I think, just how you dealt with, you know, the really emotional and really stressful sort of deaths that you've witnessed?
It's funny because sometimes it wasn't even the fact that the patient was, you know, and I'm being very candid, it wasn't even the fact that the patient had died or was dying. It was the fear that I had done something wrong. And I think that's something that a lot of medical students and interns and all doctors feel, is this fear of, have I done something wrong and am I going to be blamed? And then if you realise that no, you haven't, then you can sort of think, okay, I feel, you know, objectively sad that this very sad thing has occurred. But you do become desensitised in some ways to death. But you know, I digressed into my death certificate story, but when I was on a term where the patient had died because of a mistake that we had made and a blood result that had been missed, and, you know, I had just spoken to her child about, you know, your mother's getting much better and all the rest of it, and then the next day she very suddenly died. You know, it was a code, it was very traumatic, it was a resus, it was, you know, a total disaster. And then, you know, it had to go to an M&M meeting, and no one was blaming me per se, but it was stressful. And I guess I felt better when we went through the facts and it sort of wasn't my fault. But then I think that there's this, I always say this, there's this graveyard in doctors' minds, whether they admit to it or not, where there's a series of very bad experiences or patient deaths that they put into this little box and they close it, and it trickles out into your subconscious in other ways. And that sort of proverbial graveyard, if you like, that's when people turn to things like drugs, alcohol, unhealthy relationships, severe mental distress, suicide. So the question, how do you cope with that? I think you get a good GP. You engage with a psychologist, a good one. You talk to your friends and family if you can trust them. We all know we have friends and family we can trust or not trust. And you protect your emotional vulnerability by putting your words or your feelings into the air. Is very powerful, I think. But yeah, it's essential that you have your own GP and if you need psychologist, because like I said, the box in your brain where you have these terrible memories, not everyone's going to sit down and write a book about it. I think
Seemed like a great coping mechanism.
Yeah, well, I mean, the great therapy for me, but I mean, we need to acknowledge that very, very extreme scenarios will be happening at work, and you need to navigate a way that isn't just the hospital telling you to do mindfulness for half an hour every week.
Yeah, and look, I think you bring up a really important point about being engaged with your friends and family. I think sometimes when we get sort of stuck into this vortex of the hospital, it's work, eat, sleep, and repeat again. And I think, you know, for a lot of people, you do lose sight of the important relationships that you have with your friends, your family, your spouse, your children. You know, can you talk, you know, to that, whether it's your own experience or your friend's experience, about how to balance that?
Well, I mean, I suppose I was always very aware that I really enjoyed my life. Like, I really liked travelling. I wanted to write books, and I didn't feel guilty about that. Well, I suppose I did feel a bit guilty. You always feel guilty as a doctor. You're always guilty. You're not studying enough, you're not working enough, you know, whatever. But I sort of had this idea in my head that I wanted to do general practice because I knew that that would make me the happiest. And when I have medical students now, through my work as a GP, I always say to them, you know your pharmacology and your physiology and your anatomy, you're in 4th year or whatever, like, you know all those things. Clinically, you can auscultate a set of lungs or whatever. But my advice to you is always ask yourself now what it is you think you want out of your life. And if it's to spend 15 hours a day in an operating theatre for the next 35 years, and some people really enjoy that, that's fantastic. But if it is, I maybe want to travel a bit, I maybe want to have a family, or I maybe want to write books, or I don't know, I enjoy acting, or I'm pretty into triathlons, and I actually like seeing my friends and family, then you need to sort of, I think there's this thing in medicine where we're told your job comes first and everything else comes second. I offer the converse to that. You and your life comes first and your job comes second. Even something as important and as essential as being, it's a great word to use in the Times, essential.
Essential workers we are.
Yes, the frontliners, as being a doctor. It's like when they say happy mother, happy baby, also happy father, happy baby. I mean, it's this idea of happy doctor, happy patient. You cannot be an effective doctor if you yourself are not satisfied or happy or at peace with yourself. Yeah. And that is, I think, why, like we were saying, you need things like supportive family, supportive friends, honesty, good GPs, and also don't have fear if something bad happens at work to call whoever you're insured with. Yes, we're doing this for Avant, but that's actually very, very important, because there's nothing worse than going home feeling like I've just done something really bad and I don't know who to tell about it. There are those options. Yeah. And I didn't really know well enough when I was an intern that I had all of those options.
Yeah, and look, we hear too often about, physician and doctor burnout, and I think it's something that you're very passionate, given just the constant demands on our time, and there's just not enough hours in the day sometimes to get all the jobs done. What things do you do now, or, thinking back, that help maintain your sanity?
Well, I used to write. That helped. I travelled a lot. I have a terrible shopping habit. My housemate actually cleaned my room when I was in Western Australia because he was having someone stay and it was so disgracefully messy. And he was like, you have about 20 pairs of tan sandals. And I was sort of like, yeah, that must have been the stress. I just keep buying the same coloured pair of sandals. I'm very open with my parents. But look, honestly, the only people, unfortunately, who understand what you're going through are going to be your fellow interns. Yeah. Which is hard to say because everyone wants to support you if you're close to them, your spouse or your partner or whatever. But no one really gets it like the people who are doing the same things as you. That's why it's so important to be kind to your colleagues and to accept kindness in return. It sounds really trite, but it actually isn't. Like, I'm part of a group called Gathering of Kindness in Medicine, and I gave a talk at St Vincent's Hospital in Melbourne last year. And I was like, obviously I'm not the only person who's recognised this. There's this sense of we're really hard on ourselves and each other. And if you cannot talk, you can go home and talk to your boyfriend or your girlfriend about your day, but if they're not a doctor or they're not an intern, they don't quite grasp, I think, exactly what's happening, whereas my friends really inherently did. Mm. Does that make sense?
Yeah, look, absolutely. It's a very unique experience, and I think when you're at home over dinner recounting the horrendous fecal disimpaction that you had to do,
that's right. Yeah.
I just don't think that anyone gets it just, quite like your fellow intern.
No, and there's this expectation that we should, as doctors, we should enjoy everything that we do and we should get to work. And there's this line in my book where, she's having an argument with her housemate and says, you think we go in there every day and we just can't wait to commence the healing. And I quite like that line because, yes, you do want to heal and help people, but you're also a person who's working like hundreds of hours when you probably shouldn't be. You're tired, you're upset, you've had a breakup or you're broke, your house is burning down, your life is still going on around you. And you don't want to go in there and commence the healing. It's very, you want to just tell someone how you feel, I think.
Yeah, and look, talking about the unpleasantries, can you tell us, a story, I guess, about an unpleasant thing you had to do as an intern?
Well, these are kind of funny. It didn't turn so unpleasant or sort of amusing. I got a page from a colleague informing me that there needed to be a fecal disimpaction done in bed like 7:14 or something. And so, because we're so conditioned, sort of ran up to bed 7:14 and there's this kind of young guy looking at me, and I was sort of like, I'm here, I'm ready. And then the nurse is like, what are you doing here? I said, oh, I'm here for the fecal disimpaction. And then at that point, I think I got a text or another page kind of saying, ha, 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 you idiot. So I thought, well, some friend of mine thought it was very funny to send me a page telling me to go and fecally disimpact a patient who didn't need it, who didn't know who I was. Like, it would have been obviously horrendous had that progressed any further. But yes, interns can also do funny, stupid things like that. And that was still quite amusing, just remembering how that could have turned out. But I was ready, I was getting the gloves on.
And you probably would have still gone home and had dinner completely normally afterwards.
There's no question, because you get very used to it. And I think we get desensitized in a way that's probably not very healthy. But that's why it's good we're having these discussions, and we're able to, I think, be more open about it, as opposed to this idea of the doctor in the ivory tower who cannot be beyond reproach at any time, because it's not feasible, because by sheer virtue of being a human being, we will make mistakes, be emotional, cry, laugh, make inappropriate jokes. It's going to happen. You need to find healthy ways to deal with it.
Yeah, and look, I mean, I think that really speaks to your mantra, I think, of just being yourself. And I think that, really holds true no matter what job that you want to do. Because I think if you are genuine and honest with yourself, I think that your seniors and your colleagues will actually realise that.
Oh, absolutely. And, I trained at a big hospital, centre of excellence and all the rest of it. And I don't know how many people would say to their consultants, I want to write a book, and my consultants be very supportive. And, it was an anaesthetist from the hospital I trained at who launched my book. Some of the most support I've had is from consultants from the hospital, where I still occasionally work in the private hospital associated with it. And the overwhelming support that I received, I thought was a real testament to the fact of what decent people they were, and also how much they also understood the things that I had written about, even though they were 20, 30 years more senior than me. And that also, unfortunately, a sign that we probably need to be doing more to change the system, but I still thought that was very encouraging.
Yeah, and earlier you alluded to this culture of blame that we see in the hospital, and how that we are hopefully in an era of change.
Yes.
Can you give these guys some advice about just, I guess, starting their careers in this sort of environment?
A friend of mine, actually, the anaesthetist who launched my book, always says there's a very fine line between don't call me and why didn't you call me? And I think that's very true. So my number one piece of advice is, when unsure, even 1% unsure, always ask, because it's in that 1% that a patient is going to die. It's just Murphy's Law. The second thing is, you obviously have very thorough documentation, even if someone's telling you, especially in emergency, you need to see more patients, because if it comes to the point where someone pulls you up on an issue with a patient and your documentation's terrible because you've been too busy because someone's telling you to see more patients, they're not going to be there saying, oh, sorry, I was telling that intern to see more patients so they didn't document correctly. They'll just say, why didn't you document? So forget about that, just document. And the third thing is, yes, make sure you know who your insurer is. If you're with Avant, call them. And I've called them a lot. And I didn't really realise that as an intern that I could. But that's very powerful, having a 24-hour hotline that you can ring where you will get advice from someone when you're freaking out. And, I remember when I was actually working out in the country, I'll never forget this. There was a registrar, I was a resident, and there was a registrar next to me, and she was crying. And I was sort of like, oh, someone else is crying.
Not just me.
I was a fellow crier. But she was on the phone to her insurer, and she was saying, I have just sent a photograph of a patient's pathology or notes or something, and I meant to send it to the consultant who'd asked for it. Obviously there'd been some permission thing with the fee, everyone's fine about it, but I've accidentally, it's again 2:00 in the morning, I've sent it to somebody else. And she was stressing out. It was very stressful, right? You've just sent this highly confidential piece of information. It's obviously about a sick patient, because why would you be contacting a consultant at 2:00 in the morning? And I remember kind of sitting there listening, going, I wonder what she's going to say. I don't remember the outcome, but I do remember that she was on the phone and she was calling this number at 2 o'clock in the morning. And I was like, oh, I kind of thought your indemnity was 9 to 5, but no, it isn't. And I think that is, if you're too embarrassed or stressed to ask someone, you can always call your insurer. So, I mean, and you're not even allowed to have a job without insurance these days, I don't think. But yes, that was very, very powerful and something that I think no one told me really as an intern.
Yeah. And look, I mean, I think as doctors, we just deal with so much uncertainty.
Yes.
And look, even now as GPs, I think even more so. And I think it's a skill almost to be able to deal with being okay with uncertainty.
Yes. I mean, life is by virtue uncertain, right? But so then as you're a doctor, you're dealing with life all the time. So then, yeah, you know, it's so uncertain. And I think being a GP, as you understand, we're dealing with so many different patients with so many different pathologies. And depending on where you're working as well, you know, there's sometimes pressure to see patients or whatever, particularly as a registrar. I was on the phone to Avant constantly as a GP registrar because I was stressed. You want to do the best thing by the patient and then you find out that this or XYZ's happened. And yeah, I suppose that's what I want the people listening to this to remember. If you don't remember a lot, because so much happens when you become an intern, is that I am not this weird isolated person like, yes, I wrote this book and all the rest of it, but I was just a junior doctor like you would be, you were going to be. And my situation and my experience is very, very common. So anything that happened to me will happen to you and, you know, you're not alone, right?
Yeah. And look, I guess, I mean, with the benefit of the retrospectoscope or reflectiveness in the last sort of few years, I guess if we just had to summarise, you know, a few points for the guys listening in today, what would be maybe 3 take-home points that you really think would be helpful in getting them through internship?
I would say, I'm trying to be really honest here, I would say find your friends, you know, find your friends early and lean on your friends. Lean on your friends as much as you can. If it gets to the point where you're feeling like you are not coping, you need to then engage with a GP or a psychologist who you trust. These things are essential. We don't... Doctors are still dying by suicide at an alarming rate, to the point where for some reason they're not even calculating the exact numbers, and they should be. So that would be my first piece of advice. The second, I would say, is be kind to yourself and your colleagues. And if someone is being unkind to you, if you can, try and flag it with someone, whether that's your friends, your parents, probably your consultant, whoever you can speak to.
Yep.
And 3, be true to yourself. It's a job, and you don't know what is going to happen in your life, and you need to be happy as a doctor and as a person, and ask for help when you need it, would be my 4th. Yeah.
Well, look, thank you, Sonia. Thank you for your time this evening. It's been an invaluable opportunity having you share your insights with us. You know, I sometimes feel like internship is that lecture on personality disorders that you have, you know, the mad, the bad and the sad all at once, sometimes on the same day.
Yeah.
And, you know, there's one piece of advice that I was given when I was a junior, and I really think it rings true, is that before you start internship, when you're like a little baby medical student, you're basically like this ugly piece of coal, like a lump of coal. But, you know, after that year, the pressure that you're under, the stress, just all the insane experiences that you can't even write a book about, I think that you come out a shining diamond. And I think that each and every one of you will come out a diamond in your own way. And that's the beauty of, you know, I think being a doctor, because humans are so different, and we are human as well. So I think, you know, hopefully that you found something helpful out of today. And look, I guess I just want to end with thanks for your time. Thanks for tuning in this very unusual circumstance of COVID-19. And I think it's going to be really tricky for you guys, I think, you know, being an intern in this world. Even for us, we feel almost like medical students again, because we're learning, how do you consult patients when you're worried they've got COVID-19? How do I properly fit my N95 mask? And that's the world that you'll be going into. It's hard.
Yeah,
is all I can say. So, I mean, look, as you can see, just sort of up on screen today, if you sign up today, you'll receive a copy of the Emergency Medicine Handbook, which is a fantastic resource, which I use many a times on ED shifts, as well as the Light Extras cover for Doctors Health Fund. And for those of you who actually sign up tonight, you'll actually get a copy of Sonia's book via the QR code on the screen. There's also a link in the chat box as well. So again, thank you so much for joining us tonight. We hope you found this evening fruitful. Look, I'm happy to be contacted. I'm sure Sonia would be happy to contact it as well. If there are any other sort of burning questions about internship, training programs, life, you just want to have a chat, would really love to, for you to reach out. And, following this, we'll definitely send an email out with our emails in them as well for you to contact us. So thank you very much.